This year, as the theme Cervical Cancer Awareness Month suggests, the focus is on ending cervical cancer within a few generations. To further sensitize the local population, the Grenada Planned Parenthood Association has collaborated with other like-minded entities to host a two-day workshop for nurses and midwives working within the healthcare system and who are dealing with maternal health. Shaki Cornwall, Executive Director of Grenada Planned Parenthood Association, went into detail.
Just trained about 12 to 15 nurses to be able to insert IUDs as well as practice cryotherapy. And this is something that's significant for us because we are in the month of cervical cancer awareness. And quite interestingly, we also have a number of clinics that are going to be coming to community centers and health centers close to you.
Cornwall says these services are already available. However, because of the funding received, they are now able and better positioned to make it accessible to the outer health centers.
And these are some of the services for women, but we have to also remember that maternal health and sexual reproductive health is a concern that's beyond women. Oftentimes we think about family planning as a woman's issue and sexual reproductive health as women's issues, but it is also important that we include men. And so within those clinics, we'll also have services for men so that they can have the STI tests done.
Lynthia Buckmeyer, RN midwife attached to the GPPA, explained what's different about the training compared to her usual day-to-day duties.
Appreciative as well, yes, because it's procedures that we could do to help curve patients coming down with cancers. Because with the cryotherapy, pap smears is one of the main screening methods that we normally do to help persons to find out if they have any precancerous lesions. And then with the cryotherapy is a form of treatment that could be used to destroy those cells before they get worse than they should, and then the persons end up in the later stage of cancer. So we're very acceptive, and we're very excited, and we're glad that that initiative was taken to allow us and the other colleagues to come to get that training, so we'll be able to help our patients more.
Cancer of the cervix occurs in the cells of the cervix, which is in the lower part of the uterus connected to the vagina. The abnormal growth of cells has the ability to invade or spread to other parts of the body. Based on research, the main cause of cervical cancer is persistent infection with high-risk types of human papillomavirus (HPV), an extremely common family of viruses that are transmitted through sexual contact. According to the Center for Disease Control and Prevention, in 2020, an estimated 604,000 women were diagnosed with cervical cancer worldwide, and about 342,000 women died from the disease. The workshop was made possible by the CFLI Canada Fund Initiative. Christina John, GBN News.